Gentlemen, I want to have an honest conversation with you today. One that you might not hear very often, and one that I believe could change not just your experience in the bedroom, but your relationship with your own body and your sense of confidence as a man. We're going to talk about lasting longer during sex, about what's really going on when things don't go the way you want them to, and most importantly, about what you can actually do about it. I know this is a sensitive topic. I know there's shame around it, embarrassment, maybe even a sense of failure. But I want you to understand something from the very beginning. If you've ever struggled with finishing sooner than you wanted to, you are not alone. You are not broken. And this is far more common than anyone talks about. Nearly 40% of men experience this at some point in their lives. That's almost half of all men. Yet we rarely discuss it openly, which means millions of men are suffering in silence, convinced that something is uniquely wrong with them. Nothing is uniquely wrong with you. This is a human experience. And like most human experiences, it can be understood, addressed, and improved. So let's talk about it. First, let's get clear on what we're actually discussing. When we talk about not lasting as long as you'd like, we're talking about ejaculation happening sooner than you or your partner would prefer. Clinically, this is often defined as ejaculation occurring within 1 to 3 minutes of penetration. But honestly, the clinical definition matters less than your experience. What matters is this. Are you satisfied with your sexual experiences? Is your partner satisfied? Does the timing feel like it's within your control? Or does it feel like something that's happening to you, something you can't manage? If it's the latter, if you feel like you're at the mercy of your body rather than in partnership with it, then this conversation is for you. And I want to address something important right away. This isn't just about physical sensation or technique. This is deeply connected to your mental health, your emotional state, your relationship dynamics, and your sense of self. Men who struggle with this often experience significant distress, lowered self-esteem, anxiety that compounds over time, a sense of inadequacy that seeps into other areas of life, avoidance of intimacy altogether because the fear of disappointment feels too heavy. This is real suffering, and it deserves real attention. One of the most important things I can help you understand is that sexual response is never purely physical. It's always a dance between body and mind. And when things aren't going the way you want in the bedroom, both elements are usually involved. Let me paint a picture that might feel familiar. You have an experience where you finish faster than you wanted. Maybe it was the first time with a new partner. Maybe it was a stressful period in your life. Maybe there was no particular reason at all. But now, that experience is in your head. The next time you're intimate, part of your attention is on the pleasure, but another part is watching, monitoring, worrying. Will it happen again? What if it does? What will my partner think? This worry creates tension in your body. It activates your stress response. Your breathing becomes shallow, your muscles tighten, and ironically, all of this makes the very thing you're worried about more likely to happen. So it happens again. And now the pattern is reinforced. The anxiety grows. The body responds to the anxiety, and you find yourself in a cycle that feels impossible to break. This is one of the most common patterns I see, and understanding it is the first step toward changing it. The good news is that cycles can be interrupted, patterns can be rewired, your nervous system can learn new responses, but it requires understanding what's actually happening and approaching it with intention rather than just hoping it gets better on its own. While the psychological component is enormous, there are also genuine physical factors that influence how long you last. Let's talk about those honestly. Some men have heightened sensitivity in certain areas, particularly the head of the penis and the frenulum, which is the sensitive band of tissue on the underside. This heightened sensitivity means that stimulation builds toward climax more quickly. This isn't a defect. It's simply how your body is wired. And like many aspects of our physical makeup, it can be worked with and managed. Hormonal factors can also play a role. Testosterone levels, thyroid function, and other hormonal dynamics can influence ejaculatory control. If you're experiencing significant issues, it's worth having these checked by a healthcare provider. The state of your pelvic floor matters more than most men realize. The pelvic floor is a group of muscles that sits at the base of your pelvis, and it plays a crucial role in sexual function. Many men with control issues actually have a pelvic floor that's too tense, too tight, in a constant state of contraction. This is important because you might have heard advice about doing exercises to strengthen these muscles. And while that can be helpful for some men, if your pelvic floor is already hypertonic, meaning too tight, Strengthening exercises can actually make things worse. What many men need is not strengthening, but relaxation. Learning to release tension in the pelvic floor. Learning to breathe into that area and allow it to soften. This is counterintuitive, but it's often exactly what's needed. Speaking of breathing, I want to spend some time on this because it's one of the most powerful and underutilized tools available to you. When you're anxious, when you're approaching climax, when you're in the midst of intense sensation, what happens to your breathing? For most men, it becomes shallow, rapid, held in the chest. This shallow breathing is part of the stress response. It signals to your body that something urgent is happening. It activates your sympathetic nervous system, the fight or flight system. And this activation speeds everything up, including your path to ejaculation. Deep diaphragmatic breathing does the opposite. When you breathe slowly and deeply, expanding your belly rather than your chest, you activate the parasympathetic nervous system. This is the rest and digest system, the calm and connect system. It slows things down. It allows you to be present rather than reactive. Research has shown remarkable improvements in ejaculatory control simply from practicing diaphragmatic breathing. We're talking about significant increases in time, sometimes by factors that seem almost unbelievable, just from changing how you breathe. This isn't complicated. It doesn't require special equipment or medications. It simply requires practice and intention. Start by practicing outside the bedroom. Spend a few minutes each day breathing slowly, deeply into your belly. Notice how it feels to slow down your nervous system. Get familiar with this state. Then, begin to incorporate this breathing during sexual activity. When you notice arousal building quickly, when you feel that urgency approaching, consciously slow your breath. Deep inhale through the nose, expanding the belly. Slow exhale through the mouth. You'll be amazed at how much control this gives you. Not control through tension and gripping, but control through relaxation and presence. Beyond breathing, there are specific techniques that have helped countless men develop better control. Let me walk you through the most effective ones. The first is called the stop-start method. The concept is simple but powerful. During stimulation, whether alone or with a partner, you pay close attention to your arousal level. When you feel yourself getting close to the point of no return, you stop completely. You pause. You allow the arousal to subside somewhat. Then you start again. You do this several times, stopping and starting, building toward climax, and then backing off. On the final round, you allow yourself to finish. What this does is train your body and brain to tolerate higher levels of arousal without immediately tipping over into ejaculation. You're essentially expanding your window of control. You're learning that arousal doesn't have to be an unstoppable train racing toward a single destination. It can be something you ride, adjust, and direct. A variation of this is the squeeze technique. When you feel close to climax, you or your partner applies firm pressure to the head of the penis, particularly at the ridge where the head meets the shaft. This pressure reduces the urge to ejaculate and allows arousal to decrease. These techniques work, but they require practice. They require patience. And if you're practicing with a partner, they require communication. Your partner needs to understand what you're working on and be willing to participate in the process. This can actually be an opportunity for deeper intimacy. Instead of hiding your concerns, you're sharing them. Instead of trying to perform perfectly, you're collaborating on something that matters to both of you. There's a principle underlying all of these techniques that I want to make explicit, because understanding it will make everything else more effective. The principle is body awareness, or what's sometimes called interoception, the ability to sense and understand what's happening inside your body. Many men, particularly men who struggle with ejaculatory control, are actually disconnected from their body's signals. They're either distracted by mental activity, anxiety, performance concerns, or they're so focused on their partner that they're not paying attention to themselves. This disconnection means they miss the early warning signals. They don't notice arousal building until it's already at a critical level. By then, it's too late to do anything about it. Developing body awareness means learning to tune into subtler levels of sensation, noticing arousal when it's at a 3 or 4, not just when it's at an 8 or 9. This earlier awareness gives you more time and more options. Interestingly, research has shown that physical exercise, particularly high-intensity interval training, can improve this body awareness. When you push your body physically and pay attention to how it responds, you develop a greater capacity for sensing internal states. This translates into the bedroom, giving you better awareness of where you are in the arousal cycle. This is one more reason why physical fitness matters for sexual health. not just because of cardiovascular benefits or hormone levels, but because of this enhanced connection to your own body. For some men, particularly those with heightened physical sensitivity, there are products that can provide additional support. Delay sprays and creams contain mild numbing agents, typically lidocaine or prilocaine, that reduce sensation in the most sensitive areas. When used correctly, they can significantly extend time to ejaculation. The key is finding the right amount for you. Too much, and you may lose enough sensation that maintaining an erection becomes difficult. Too little, and it won't have the desired effect. It usually takes some experimentation to find your sweet spot. These products are typically applied 10 to 15 minutes before sexual activity to allow them to absorb. Some men find it helpful to wash off any residue before contact with a partner, both to prevent transfer of the numbing agent and for hygiene. These aren't a cure or a permanent solution in themselves, but they can be a helpful tool, especially while you're working on the other aspects we've discussed. They can reduce performance anxiety by giving you confidence that you have some backup. And sometimes, having a few successful experiences can begin to break the negative psychological cycle. In some cases, medication can be an appropriate part of the solution. I want to discuss this honestly because I believe you deserve to know all your options. Certain antidepressant medications, particularly SSRIs, have a side effect of delaying ejaculation. For men with significant issues, these medications can be very effective when taken daily. There are also formulations available in some countries that can be taken on an as-needed basis before sexual activity. These aren't available everywhere, so you'd need to discuss options with your healthcare provider. It's important to understand that these medications come with their own considerations and potential side effects. They're not right for everyone. But for some men, particularly those who haven't found relief from behavioral techniques alone, they can be genuinely helpful. The most effective approach is often a combination. Medication to provide some immediate relief and confidence, combined with behavioral techniques and psychological work that create lasting change. Over time, many men are able to reduce or discontinue medication as their natural control improves. This is a conversation to have with a healthcare provider who understands sexual health. Don't be embarrassed to bring it up. This is a legitimate medical concern, and you deserve competent, compassionate care. There's an important relationship between ejaculatory control and erectile function that I want to address. For some men, premature ejaculation develops as a response to concerns about erection. The logic goes something like this. If I'm worried about losing my erection, I need to hurry. I need to get to completion before things stop working. This urgency, this rushing, trains the body toward faster ejaculation, and it creates a self-perpetuating cycle where erectile concerns lead to ejaculatory issues, which create more anxiety, which worsens both problems. If this pattern feels familiar to you, addressing the erectile concerns may be an important part of solving the ejaculatory issues. Sometimes, medication that supports erectile function gives a man enough confidence that he can slow down and develop better control. This is another area where working with a healthcare provider can be valuable. They can help you understand what's primary and what's secondary, and develop an approach that addresses the root of the issue. I've touched on psychology throughout this conversation, but I want to address it directly because for many men, this is where the real work needs to happen. If you're carrying anxiety about sexual performance, shame about past experiences, negative beliefs about yourself as a lover, these mental and emotional factors will continue to influence your body no matter what physical techniques you use. Working with a therapist who specializes in sexual issues can be profoundly helpful. This isn't about lying on a couch and talking about your childhood, although understanding your history can be valuable. It's about developing practical tools for managing anxiety, reframing negative thought patterns, and building a healthier relationship with your sexuality. Cognitive behavioral approaches can help you identify and change the thoughts that fuel performance anxiety. Mindfulness practices can help you stay present during intimacy rather than getting lost in worry. Communication skills can help you talk with your partner in ways that reduce pressure and increase connection. There's no shame in seeking this kind of support. In fact, it takes courage and wisdom to recognize that you could benefit from help and to pursue it actively. Whatever approach you take, I want to encourage patience. This is not a problem that typically resolves overnight. The patterns you're working to change have usually been established over months or years. Reversing them takes time. Most of the techniques we've discussed require several weeks of consistent practice before you'll see significant results. Some require months. This can feel frustrating when you want the problem solved now. But here's what I want you to understand. The work you're doing is building something lasting. You're not just treating a symptom, you're developing genuine skills and capacities that will serve you for the rest of your life. Quick fixes, if they exist at all, tend to be temporary. The men who achieve real, lasting improvement are the ones who commit to the process, who practice consistently even when progress feels slow, who don't give up when they have setbacks. And there will be setbacks. There will be times when things don't go as you hoped, despite your efforts. This is normal. It doesn't mean the techniques aren't working. It just means you're human, and human change is rarely linear. When setbacks happen, treat yourself with compassion. Notice what you can learn from the experience, and get back to your practice. If you're in a relationship, your partner is an important part of this journey, and how you communicate with them about what you're experiencing matters enormously. Many men hide their concerns, either avoiding intimacy or pushing through and hoping their partner doesn't notice or care. This creates distance. It prevents the kind of teamwork that can actually help resolve the issue. I encourage you to consider talking with your partner openly about what you're working on. This doesn't have to be a heavy, serious conversation filled with shame. It can be a practical discussion about trying some new things, about what you're learning, about how they can be part of the solution. Many partners are far more understanding and supportive than men expect. They want to help. They want intimacy to work for both of you. They're often relieved to finally understand what's been going on. And when your partner is involved, the behavioral techniques become much easier to implement. The stop-start method, the focus on breathing, the communication about arousal levels. All of this works better when two people are collaborating. This can actually become an opportunity to deepen your intimate connection. Instead of sex being a performance you're trying to get through successfully, it becomes an exploration you're doing together. The pressure decreases. The pleasure can actually increase. I want to offer you a reframe that might change how you think about this entire issue. Our culture tends to present male sexual performance in very mechanical terms. You should be able to last a certain amount of time. You should be able to control your body completely. Any variation from the ideal is a failure. But what if we thought about it differently? What if the goal isn't perfect control, but rather presence, connection, mutual pleasure? What if lasting longer isn't about gritting your teeth and holding back, but about expanding your capacity for pleasure and sensation? About being so present in your body and with your partner that time becomes less relevant? The men I've seen who develop the healthiest relationship with their sexuality aren't focused on performance metrics. They're focused on the experience. They're curious rather than anxious. They're connected rather than controlling. This shift in perspective can be profoundly liberating. It takes the pressure off. It makes sex about something more than timing and mechanics. Yes, work on the practical techniques. Yes, develop greater control and awareness. But hold it all within a larger context of presence, pleasure, and connection. As we come to the end of this conversation, I want to emphasize something broader. Your sexual health is part of your overall health. The same things that support your general well-being support your sexual function. Sleep matters. When you're sleep deprived, everything suffers, including sexual performance. Prioritize getting enough rest. Stress management matters. Chronic stress keeps your nervous system in a state that's incompatible with relaxed, present sexual experience. Find ways to manage the stress in your life, whatever works for you. Physical exercise matters. We've already discussed how it improves body awareness. It also supports cardiovascular health, hormone balance, mood, and confidence. Move your body regularly. Mental health matters. If you're struggling with anxiety or depression more broadly, addressing those issues will benefit your sexual life as well. Your relationship health matters. If there are unresolved issues, resentments, or communication problems with your partner, these will show up in the bedroom. Do the work to keep your relationship strong. All of this is connected. Taking care of yourself in one area supports you in all the others. If there's one thing I want you to take from this conversation, it's that you deserve support with this issue. You don't have to figure it out alone. You don't have to suffer in silence. Talk to a healthcare provider. Explore the options we've discussed. Consider working with a therapist who specializes in sexual health. Communicate with your partner. These are not signs of weakness. They're signs of wisdom and self-respect. You are worth the effort it takes to address this. Your pleasure matters. Your confidence matters. Your intimate connection with your partner matters. And this can get better. With understanding, with practice, with patience, with support, this can genuinely improve. Men do it all the time. There's no reason you can't be one of them. So where do you go from here? Start with awareness. Begin paying closer attention to your body, your arousal patterns, your breathing. Notice what happens when you're anxious versus relaxed. Choose one technique to focus on first. Maybe it's diaphragmatic breathing. Maybe it's the stop-start method. Whatever feels most accessible to you. Practice it consistently. If you think medical support might be helpful, schedule an appointment with a healthcare provider who takes sexual health seriously. Don't let embarrassment keep you from getting the help that's available. If anxiety or psychological factors seem significant, consider reaching out to a therapist who specializes in this area. The investment of time and money can pay enormous dividends in quality of life. And if you're in a relationship, consider having an honest conversation with your partner. Invite them into the process. Let them support you. This is a journey, not a destination. Be patient with yourself. Celebrate small improvements. Keep going even when progress feels slow. You have more capacity for change than you might believe. Your body can learn new patterns. Your mind can develop new responses. Your experience can improve. I believe in your ability to grow and change. I hope you believe in it too. Take care of yourself, gentlemen. You're worth it. If this conversation was helpful, consider sharing it with someone who might benefit. And remember, seeking to improve yourself is always something to be proud of, never something to be ashamed of. Remove these words.